No COVID effect, sexually transmitted infections, research in the US. It's disturbing that COVID-19 pandemic couldn't arrest the spreading of sexually transmitted infections, STIs, in the US. The figures reveal that even if the rates of STIs dropped in the early months of COVID-19 in 2020, later they went up. According to the data from the Centers for Disease Control and Prevention, CDC, diverting resources to control COVID-19 badly led to an increase in STIs. And in 2020, after the initial dip in STIs, there was a research, explains the CDC report 2020, titled Sexually Transmitted Disease Surveillance. The initial days mentioned in the document are quite different from all the other times. Regulations like lockdowns and social distancing were in place. People were fearing to associate with others freely. Of course, this would have brought down the rate of STIs considerably. The data on diseases like gonorrhea, chlamydia, and syphilis are analyzed in the document. It shows that in the first months of the year, cases were lesser. But by the second half of the year, it rose to a record high. Compared to 2019, the rate of gonorrhea increased 10% and syphilis 7%. It's alarming that congenital syphilis, that's passed from mother to infant, increased 15% from 2019. 13% drop in the reported cases of chlamydia don't make health experts happy. The disease is asymptomatic and could be diagnosed only through in-person screenings like pap smears. More people would have avoided such tests, fearing the spread of pandemic in 2020. Young people, the poor, gay and bisexual men, and racial minorities suffer more due to STIs. Half of the patients are of the age group 15 to 24. Racial and ethnic minorities have to bear the pain of both the pandemic and the STIs. Why such high rates of STIs is a serious question, but those who keep an eye on the healthcare system expect a better tomorrow. The most encouraging factor towards this is the 5-year plan of the federal government to tackle the health issues created by STIs. More testing facilities and manpower have been added to the system. This will make detection and care easier and affordable.